Hi guys, this is Dr. Khan from Your Family Doctor. So I thought I'd start a new playlist on some of the drugs and medicines that have been trending recently in the medical field. So thought I'd start off with a drug which is probably well known to you guys now, known as Remdesivir or Veklury, which is a brand name, and which has been prescribed in the US for emergency use in patients with suspected or confirmed COVID-19. So let's get straight to it. So here are 10 quick facts about Remdesivir or Veklury. So the first is the US Food and Drug Administration, the FDA, has issued an emergency use authorization. So it's only licensed to be used in emergency use for the treatment of suspected or laboratory confirmed coronavirus disease or COVID-19 in hospitalized adults and pediatric patients. Remdesivir is what we call a nucleoside ribonucleic acid polymerase inhibitor. Okay, you don't need to remember that name. All that it means is that it's a medication that breaks down a certain protein, part of the structure of the coronavirus. So if it breaks down this protein which forms part of the structure of the coronavirus, then you'd suspect that the coronavirus will slowly break down and will stop working and stop causing the negative effects it tends to have. The chemical name for Remdesivir is this. It has a molecular formula of and a molecular weight of, and this is what its structural form looks like in medical terms. And the way that Remdesivir works is that once it's been inserted through the vein, through an IV or intravenous infusion, it distributes into the cells where it's broken down to its pharmacologically active compound, so the compound that actually does the job of killing the virus. As mentioned before, it's given through a vein or an intravenous or IV infusion one time each day for up to 10 days. And this really depends on what your healthcare provider thinks is best for you. And the whole idea behind this is that Remdesivir will help to reduce the amount of coronavirus in your body, and this may help you to get better faster, essentially. However, some studies have shown that Remdesivir does not work very well when it's been given with chloroquine or hydroxychloroquine. A patient's kidney functions need to be tested before they're given Remdesivir, especially something called the eGFR, the glomerular filtration rate, which is a measure of the function of the kidneys, and this value should not be below 30. A blood test to measure the liver function should also be taken, since there was some elevation of the liver enzymes in patients being treated in clinical trials, including those being treated for COVID-19 with Remdesivir. In terms of pregnancy, Remdesivir should only be used if the potential benefit justifies the potential risk for the mother and the baby. In terms of the side effects, these include hypersensitivity reactions, including infusion-related and anaphylactic reactions, which are severe allergic reactions. And these have been observed with the administration of Veklury or Remdesivir. And some of the symptoms and signs of this may include a low blood pressure, fast heart rate, slow heart rate, problems with your breathing, wheezing, swelling of your face, a rash, feeling nauseous or vomiting, and shivering. Please leave any thoughts and comments on what you know about Remdesivir and what implications this may have on coronavirus or patients that are being treated with COVID-19. Also, leave any thoughts or comments in the comment section below about any drugs or medicines or anything else you'd like me to talk about. And finally, if you are new to this channel, then please consider subscribing and hitting the bell notification and sharing my channel videos to your family and friends. Thank you.